Hi everyone, Dr. Benedetto here today again with a short health video. As you can see from the title, just bear with me, today's probably going to be a bit of a rant. Now if you've seen my videos before, you may think I'm always ranting about stuff, but today it's just something that really got under my skin, so I'm going to shoot from the hip here. So, quick story. I'm cruising through social media a couple days ago, right? And I don't even know who this person was. Wasn't like a friend of mine on Facebook or anything, but I see this picture come up of an individual who is getting treatment, medical treatment at a hospital. Okay, this is, I guess, the nature of social media nowadays. We put everything out there. So this individual is ill. So this individual has I don't know who it was. Again, it wasn't a friend or anything of mine, but this individual, from the comments and the description, I learned everything about this person, has an autoimmune inflammatory bowel disease, right? So there's a couple of them out there. You've probably heard of Crohn's disease and ulcerative colitis and things like that. So this individual had ulcerative colitis, and which is an autoimmune disease of your digestive tract, okay? Just bear with me for a sec, all right? Autoimmune disease of your digestive tract, okay? Now, there's a picture of this individual getting treatment, okay? You sit in a chair. What they do, a lot of the medications or the treatments for these types of problems are infusions, right? So the medications they give are infused, so you have to sit in a chair, and it takes hours sometimes. And they put the IV in, and they infuse it into you, and you sit there and you wait. You read or play or whatever. In this picture, this individual sitting there smiling, whoever it was, Bob Jones, been having a rough time with the symptoms, so hopefully this treatment will help. And picture of him sitting there in the chair. What do you think is next to this person in the chair, right? So sitting in the chair, you can see it in the picture, right? There's a bag of Doritos, there's a chocolate milk or a juice or something like that. I mean, there's food sitting around. So this individual snacking on these things, which are terrible for you, right? We all know that. These processed junk foods. And this person has an autoimmune disease of the digestive tract. Does anyone else not think this is insane? Right? Sitting in a hospital, getting treatment for an autoimmune inflammatory bowel disease, eating foods that's going to cause inflammation and reactivity in the immune system in the bowel. Am I taking crazy pills? It's not me, right? I mean, that doesn't make sense, right? So this is medicine, right? So this person is in a medical facility getting treatment and has an inflammatory bowel disease and is not being taught anything about what to eat or what not to eat to help their condition. They just get the treatment and do whatever you want. Is that not insane? Am I crazy? I had a patient come in my office one time, had type 1 diabetes, right? So type 1 diabetes is an autoimmune disease where your pancreas gets attacked, and so you got to take insulin, right? You may know someone who has the insulin pump or they take shots. So this person told me that their endocrinologist, right? So the endocrinologist is the doctor who's managing the diabetes. When this patient asked the doctor, like, what kind of dietary changes should I make? I have diabetes. I should make some diet changes, right? And this doctor said, don't worry about it. Eat whatever you want. Just make sure you take your insulin. And I looked at my jaw hit the floor. And that's why they were in our office, because they needed some help with some of the dietary aspect of things. But it's rough out there, gang. I mean, there's not a whole lot of help in the medical world with this kind of stuff. So I mean, look, all disease, really. I mean, look, what you're putting in your mouth, what you're putting in your body, is kind of dictate how your body runs, right? I mean, it's like gas in your car. So, but especially if you have an autoimmune inflammatory bowel disease, crazy. So you take one step, so just take these harmful, nasty medications with all these side effects and eat whatever you want. It's not going to affect your digestive system at all. I mean, insane, people. Insane. All right, that's it. Rant over. Everyone enjoy your day. If you have any questions, you can always post them below. If you like this video, give it a nice thumbs up. Comments, concerns, go ahead. But yeah, sorry. Hopefully that wasn't too much of a rant. This stuff drives me nuts. Like, I see that, and no wonder we're so sick. No wonder we're so ill. Because that's the medical care in the richest country in the world, with all the money we spend in healthcare. It's all trying to put the toothpaste back in the tube. So thanks for bearing with me today. We'll see you guys on the next video.